four are typical and fifth is a atypical vertebra. A lumbar vertebra is identified by its large sized body, the absence of costal facets on the body, as we had seen it in the thoracic vertebra, and also by the absence of foramen in transverse process, that is, as we had seen it in the cervical vertebra. Now, beginning with the typical lumbar vertebra, the body is large, kidney shaped, and is wider from side to side than from before backwards. The height of the body is slightly greater anteriorly than posteriorly. The vertebral foramen is triangular in shape and is larger than in thoracic region, but is smaller compared to the cervical region. The pedicles are short and strong. The inferior vertebral notches are much deeper than the superior vertebral notches. The laminae are strong, thick and broad. The spine forms a vertical quadrilateral plate which is directed almost backwards. The transverse processes are thin and tapering. The posterior-inferior aspect of the root of each transverse process is marked by a small rough elevation, the accessory process, which represents the true transverse process of the vertebra. So, the remaining part of the transverse process is the costal element. The superior articular processes lie farther apart than the inferior articular processes. Each process bears a concave facet facing medially and backwards. The posterior border is marked by a rough elevation, the mammillary body or the mammillary process. The inferior articular processes lie nearer to each other than the superior articular processes. Each process bears a convex facet facing laterally and forwards. Now we'll see the fifth lumbar vertebra. The most important distinguishing features is the transverse processes are thick, short and pyramidal in shape. Their base is attached to the whole thickness of the pedicle and it encroaches on the sides of the body. The distance between the inferior articular processes is equal or more than the distance between the superior articular processes. The spine is small, short and rounded at the tip. Now we'll see the same features in another fifth lumbar vertebra, that is the transverse processes.